lately in the clinic. One part is stress. Everybody knows there's a little bit of stress happening in society today. Whether it be economic, relational, you can fill in the blank of what kind of stress people are going through. For example, just this week, a new patient came in, a mom of 3. When she came in, she actually said the world was placed on her shoulders. That's how much stress she felt from just trying to take care of kids, trying to do work at home, etc. Just after 2 times working with her, just yesterday, she came to me and she said, I just don't want to shoot things in the foot too much, so she knocks on wood. She goes, but it feels like I have myself back. And so this weight of the world, the stress that she felt, was actually relieved because your body compensates when there's stress. Cortisol is released, the blood pressure increases. All that does have an effect on your physical system too. And so through even emotional stress and psychological stress, chiropractic can help by putting the body at ease, which will help with the mind at ease. Immunity. This is kind of an ironic one, because coming into the meeting today, I talked to a handful of people that are already talking about immune systems. It's really interesting once you see, and this is one of the things that I say through different speeches here, being I that help me put my shoes on in the morning, is that adjusting the spinal column, when I say moving a bone from out of position to into position, is some of the most amazing experiences that I can actually tell you about. Because it's not just pain, because pain is one of the reasons why people come see a physician or a doctor, is to get rid of pain. Not many patients come to the chiropractor thinking about my acid reflux, my asthma, my digestion. They're just thinking about headaches, neck pain, low back pain, or immunity, for example. I don't do any antibiotics. We always talk about philosophy about antibiotics another time of day if you want to. A gentleman, an advisor, he's talking all the time to his clients. He needs to be able to talk. He was coming down with a throat infection, getting all hoarse. He was really concerned about being able to do his job. So through the techniques that we have in my office, we didn't use antibiotics. We actually used natural healing to be able to put the body back into fighting shape, which is here. The amount of time that a Z-Pack, which is an antibiotic pack, usually takes 4 to 7 days for it to take effect, etc., etc. We're able to have that same effect, but even better because it was true healing, because there was no adverse effects of antibiotics. Anybody in here taking an antibiotic and their stomach gets all screwy, gets a little digestive problems, that's one of the main things that we come across with antibiotics, and there's a reason behind that. Through this whole effect, he actually stimulated his immune system, so down the road his immune system will be stronger. But he also had his goal done. He was able to do his work without losing a voice, so he didn't lose business. The immune system is a great influence from the central nervous system because it's all regulated from a center and cortex in your brain. That's how chiropractic can actually influence your immune system, is just making sure your central nervous system is working as close to 100% as we can. Then of course we've got to do our part, we got to sleep, we got to eat, but what I can do is help that body do what you can to fill in the missing spots that you're not able to do. Last one is arthritis. Arthritis is one I've talked about here a few times in our group, mainly because arthritis is a big concern for people, and it's not an old person's disease. Arthritis actually comes from wear and tear in a joint that's been out of alignment. Now we're talking about osteoarthritis. We're not talking about rheumatoid, ankylosing spondylitis, gout, etc. I'm just talking about the whole people's arthritis, the osteoarthritis. I have people in my office from 30, 35 years old all the way up to 80-year-olds that come in for arthritic care. And yes, 30, 35-year-olds do have arthritis. It all depends on what their body's genetically made up and how hard they push their body during their life. Both these people come in for regular chiropractic adjustments, and it helps with their arthritic pain. It helps with the range of motion, which are the 2 things people complain about with arthritis. When we look at a picture of arthritis, you can see a normal joint. I don't know if you can see from that far back there, but we're looking at the space right in here. It's nice and thick. From here you can see how that space is deteriorating, even worse, to the point of fusion. Arthritis is a disease because it's taking the body away from ease. What we do through chiropractic is put motion back into that joint to either slow down the degeneration process or perhaps even stop the degeneration process. So through the examinations, I do x-rays in my office, I do range of motions and other techniques to find out, okay, Mrs. Jones, you do have arthritis. Oh, Doc, how can you help me? Well, we'll restore motion back to the joint, and that, in essence, stops, delays, or even completely ceases your arthritic process. What we call spinal injuries, or a bone that's out of alignment, is a subluxation. And that causes damage to the bony joints, but also causes interference to the delicate spinal nerves that will decrease your health and healing potential. Because what we got here in the backside, again, like we saw in the MRI, are all your nerves, or all the nerves coming through here. If that hole where that nerve is coming through is nice and patent, that nerve's going to have no pressure. If you have arthritic conditions to where that this space is getting smaller, that space where that nerve comes out is also smaller too. And that's going to put pressure on that nerve. So they're intense, you can actually get radiating pain, you can get other pressures and other symptoms that you're not even realizing that's coming from nerve pressure. And then the applause again is for the things that I say puts my shoes on in the morning. Because these are different effects that patients will come to me and tell me when they come for headaches, when they come for low back pain, mid-back pain. These are things they fill in the blank later on down our treatment that say, Doc, this is the weirdest thing, but my blood pressure is better. My menstrual cycles, I'm actually getting more and more regular. Hiccups gone, coughs, acne, nausea, ringing in the ears. I mean, you guys can read all these, and these are the things that I have a poster in my office that says why I'm a chiropractor, et cetera, et cetera. The last sentence is because I get to experience miracles every day. Working with the body is a real honor. It's a privilege to be able to do it through chiropractic. From coming from a physical therapy standpoint, understanding the medicine and the Western science, but also taking it back to a philosophy of bone setting that's been around for centuries of years. The philosophy of bone setting has never changed. It's actually been more and more specifically fine-tuned to what we call as chiropractic today. And once you get a chance to actually let loose the power of the central nervous system, some amazing, next to miraculous things can happen. So with these cards here, we're saying when power's on, when my patients, when anybody gets adjusted, you actually get a release of so many systems in your body. It's working better within 7 to 10 seconds after I'm done with it. So that means better blood flow. That means better neurological flow. That means better hormonal regulation. All three of these facts have actually been studied through science to actually say that a chiropractic adjustment, in other words, a tuning up of the central nervous system, can actually help relieve blood, circulatory, and neurological impedance to help your body actually heal and function better. So that's why I tell my patients, power's on, after every time I'm done with it. So the way you guys can help me is, again, for people that are stressed out, the immune system's not working, and arthritis. Those are the three main things I'm going for. But if you take a step beyond that and connect a little more, really the power of your central nervous system and the way it can relate to your spine, anybody that comes across with pain or any other kind of symptoms, I'll be more than happy to talk to and tell them if I can help them, I will. And if I can't, I have other resources that will be able to. Thank you for your time.